Hello, everyone. I hope your 2025 is off to a great start, and welcome to our E4health CDI Roundtable, CDI Compliance 360, Auditing for CDI Quality and Accuracy. My name is Stacy Josten, and I have the privilege to lead the CDI service team at E4health. We appreciate your attendance today and taking time out of your busy schedules. If we were in a room together, I would love to see a show of hands of how many of you enjoyed a CDI audit. I know I certainly didn't when I was reviewing records as a CDS. I remember the days when the thought of a CDI audit would make me a nervous wreck. The process often felt like a gotcha, and I couldn't shake the feeling that I was being judged for something I didn't fully understand. It was uncomfortable, and I didn't enjoy it at all. I think that's exactly why I'm so passionate about the value of CDI audits and work to create them in a way that doesn't feel like a test or criticism. When done right, CDI audits can be incredibly valuable both for the CDS, the leader, the organization. A CDI audit should not be about pointing out failures. They're about identifying what's going well and finding areas where we can improve together. It's an opportunity for growth and learning. Allison tells it as a gift that you're investing in your team. Let's face it, none of us can learn every detail of the 70,000 ICD-10 codes in every coding clinic. That's where audits come in. They help us see where we're excelling and where we might need a little extra focus. If approached in the right mindset, and what I hope is what you'll hear today is that CDI audits can be a tool for continuous improvement and not something to fear. So our hope is that each of you will learn a little something, feel a little inspired, and we hope to accomplish these three learning objectives. That you'll be able to explain the process for conducting a comprehensive query compliance review. You'll understand the importance of a missed query opportunities and describe the value of a CDI audit reporting. We have a jam-packed session, so we'll not be able to pause for questions. I see a lot of hands up, Mike. I'm not sure why all the hands are up. Oh, maybe they're all doing about not the audits, maybe. However,
So.
if you put your questions in the post survey, we will do our best to answer them. And at the end of today's presentation, we will put in the chat a link to a survey. Please fill that out. Your feedback is super important to us, and that is also how you'll receive your ACTA CEU. Before we jump into today's roundtable, for those of you that are not aware of e4health, we are a team of over 1,000 team members of three combined companies of e4, Intellis, and eCatalyst. We serve over 400 clients across the U.S. and growing every day. It's our absolute pleasure to work with many of you listening in. We also recently received, for the second year in a row, #1 in HIM for Black Book, and this year we also were for CDI Consulting, which is what we're really proud of. And we have an expert panelist coming up a little bit later in our presentation. Thank you, Kathy, Cheryl, and Michelle, and we'll also be hearing from Allison. We really appreciate you sharing your expertise with us, and we'll get to hear from them a little bit later. So I'm going to just start with a little bit of a CDI or audit overview. And if you've listened to me present before, the slide will look familiar, but I always think it's a good reminder. I just always got to just start that because it just reminds me and hopefully reminds all of you about the incredible value what CDI does bring to an organization. When I started CDI 15 years ago, it was the transition to MSDRG, and the only thing our team reviewed for were CCs and MCCs. If the patient had an MCC, we didn't need to go back. In the case, we moved on. We called them fully loaded. 3-hole punch the worksheet, put it in our follow-up binder, and moved on. I wonder if any of you remember doing that in the day when we still printed everything out and had paper medical records. But our profession has progressed, and our goal now is to capture that clinical story of each patient. So that's represented in the data. We now want a second CC and MCC. We care about SOI, ROM. We work with our quality departments to review for PSIs and hacks. We do second level reviews, clinical validation to prevent denials. And now our queries are being evaluated for compliance. And now we're adding risk adjustment, HCC, Zelix Hauser, Vizient, all to the mix. Talk about job security, right? So at e4health, we are passionate about the value of CDI audits. If you haven't caught on up to that, and I believe they're essential for the continued success of any CDI program. Our coding partners, they've been conducting audits within their teams for a long time, and now CDI is following suit. For a program to progress and stay current, conducting regular CDI audits is vital. And here's a few key reasons why. accurate reimbursement. We want to ensure that there's not money left on the table. And in today's budget conscious environment, it's crucial that hospitals are properly reimbursed for the care they provide. Denials, they're so frustrating, and it's an ongoing challenge for so many organizations. But CDI can play a crucial role in preventing those clinical denials up front. While clinical validation queries can be challenging and often my least favorite to write, they are vital for preventing denials. Reputational data, our hospitals are starting to care about that and how they're rating against competitors. They utilize those different organizations like US News World Report, Leapfrog, HealthGrade, CMS Stars, and CDI can make a contribution to those. Adherence to client or compliance, query compliance is this essential, and we're seeing more queries are used in denials. So it's imperative that our teams are following the ACDIS and AHIMA query practice brief. Audits help ensure that your team is following your policies and procedures, such as timeliness of reviews, proper reconciliation processes. And then I think audits are just key in staff and educational development. The results of audits just offer such a valuable insight into areas where education and training may be needed, and identifying those gaps in those areas that your staff just might need a little extra help. And this data-driven approach can help guide important decisions such as program expansion, staffing adjustments, and what other education is needed. And finally, peace of mind. At the end of the day, most professionals all have the best intentions and strive to do their best work. And audits just offer that peace of mind, validating that everyone's doing the best they can. And unfortunately, if you've been in leadership long enough, there's always just a few strays that you have to just kind of guide along. So definitely huge value in a CDI audit. I like to think of audits as a 360-degree approach, really a comprehensive method that involves evaluating all of the valuable work we do from multiple angles. A 360-degree approach to CDI audits provides a thorough review of all aspects of the CDI process. It can help see what's going well, identify potential issues, and find areas of improvement. The goal is to ensure that the clinical picture of each patient is accurately represented. You get tired of hearing me say that, but that really is our goal, always front and center. What is the documentation telling about the patients that we're taking care of? And this approach really includes reviewing the clinical documentation, ensuring that accurate patient record, checking if the CDI team is following and understanding the current process and workflow, verifying adherence to compliance, especially in the query practice, using data to identify trends and monitor performance, tailoring training for the CDI team based on the audit findings, and even this cross-functional collaboration, analyzing how providers and teams work together, including looking at provider responses and CDS coder mismatches, working DRGs. And then this also, if you utilize all those different aspects, then you'll have a strategic plan in place and for continuous improvement. You can see where your strengths are and celebrate those. And then you can also look at areas of opportunity to help advance your CDI program and your CDI's team's CDI knowledge. So a quick glimpse of how we like to do it at E4 and what we do include in our 360-degree approach is really trying to evaluate CDI program and CDSs from multiple angles to really be able to look at all the different areas and, hey, you're doing this great, keep doing that. And you know what, here's an area that you can improve upon. So we look at query opportunities, identifying documentation and clinical validation that maybe got missed, query compliance, using that ACDIS AHIMA brief with feedback to reduce future compliant risk. Documentation capture is just identifying those opportunities that everything's documented, but it got missed. Our team is a team of nurses, but sometimes when we're in the record, we see some things that could have helped the record by capturing another additional diagnosis or procedure. A process review, this is really customizable to each program, checking if the process like DRG assignment and timely reviews are being followed and followed, and then preventing retrospective queries. And then something that a customer asked us a while back is, hey, we really kind of want analysis of provider response. We have a great response rate, but we're getting a lot of unable to determine. So we look at appropriateness of provider response. So this is all supported by our E4 auditor for CDI, which I'll get to demonstrate later in the presentation. So that's just really a high-level overview. A 360 approach, a comprehensive approach are lovely, right? We would love to do that. However, let's just be real. Sometimes we don't have all the time, capacity, or budget to complete this. A lot of you are probably like, "What is she talking about? We don't can barely, do what we need to do." So what we wanted to do is, okay, that would be the goal, right? That would be ideal. But then how about if we narrowed it down to just the two highest priorities? And that is to give you a deep dive into query compliance and query opportunity audits. And I'm going to turn it over to Allison as she will explain the process for conducting a comprehensive query compliance review. Allison?
Well, thank you, Stacy. And listeners may recognize this slide from previous roundtables, but I did want to quickly level set our discussion and share when we conduct a comprehensive query compliance audit, we use the 2022 ACDIS and AHIMA query practice brief as our true north and our source of truth. For today's discussion, I'd like to focus on the actual process of how to conduct a comprehensive audit, but would encourage those listeners who haven't viewed our previous roundtable that discussed why compliance is so important to go back and view that presentation, which is still available on demand. So like Stacy explained, before our goal of conducting a comprehensive query compliance review is to identify if query compliance standards are met and provide feedback to mitigate future compliance risk and enhance query writing in general. Our auditors follow a 20-step process when evaluating queries, and we apply that same process whether we're auditing a small regional facilities queries or a large academic medical center, for instance. This provides standardization from audit to audit for staff and program comparison, as well as solidifies our advice and recommendations that we give to customers. All of our CDS performance audits here at e4health contain 1 hour of education that's credentialed by an ACDIS CEU, and it's based off the audit findings that we identify. Most of the time when we do a baseline audit for customers, once the leadership team reviews the preliminary results, the education topic is chosen of how to achieve a compliant and valid query practice. And when we provide that query compliance education to CDSs, I like to give them this checklist of questions to really ask themselves before leaving a query as a reference. And this is also something that anyone listening in could use when you're establishing your process for auditing for query compliance. So essentially, when either you're evaluating or leaving a query, ask yourself first if the query diagnosis adds value to the current documentation and if the timing of the query is appropriate. Then work your way from top to bottom, assessing the query, starting with the title, making sure that the title viewed by providers is non-leading in nature and doesn't include any impactful information like reimbursement, quality indicators, specific information, or new information that's not included in the health record, such as the desired response. Then evaluate the clinical indicators and make sure that they're sufficient and they're supporting what the query is asking. Next, examine the question or how the query is delivered to the provider, ensuring the query is free of leading verbiage that would direct the physician to a certain response or indicate impact on reimbursement, quality measures, or other reportable data. Make sure that there's no bolding, highlighting, or underlining, and only the objective data is presented without any subjective interpretation. Then look at the options provided, ensuring that they're all clinically supported and appropriate based on that patient's clinical scenario, and the choice of other or similar terminology is included on multiple choice queries to allow the provider to customize their response. And if the query is a yes, no, or asking present at admission status, make sure that there's a choice of unable to determine. Overall, from a 30,000-foot view of process paired with recommendations, I would suggest starting by having a consistent standard to what you're measuring the queries to, which I would recommend using the 2022 ACDIS and AHIMA Query Practice Brief. Consider how you're going to grade, score, or categorize your findings. I found success classifying compliance reviews into two simple categories: query standard met and query standard not met. As an auditor, you can still suggest opportunity for improvement on queries where the standard is met and the query was found to be valid and compliant. So for instance, you could recommend rephrasing a question to make that query clearer to the physician, or suggest adding additional clinical indicators for support. We consider those educational or enhancement suggestions. And if you determine the query standard is not met, be very clear as to why the query is found to be either non-compliant or non-valid, citing explicitly what in the query made it conflict with the practice brief, and include the reference or guidance from the brief that supports your findings, and give recommendations to the CDS on how to make that query compliant. From a leadership standpoint, you're going to want to analyze department and individual CDI trends. So it's very common when we work with customers on a baseline or an initial audit to have a query compliance rate in the 60 or 70th percentile. And most of the time, the compliance findings are relatively easy or quick fixes, such as updating templates or providing education and awareness to staff on the findings and expectations. The key is to go back and re-audit staff after about 3 to 4 months following the education or interventions implemented, where you can identify any recurring trends, continued issues with templates, or identify new compliance behavior, as well as celebrate those successes of improvement seen. So I'll turn it back over to Stacy to walk us through understanding the importance of missed query opportunities.
Thank you, Allison. So queries can often be missed for many reasons. Hindsight's 2020, you get interrupted, you're viewing other things, but it's important to remind CDI staff and providers that what we do and the words we use matter. Documentation matters. As CDS professionals, even though we're no longer helping save lives, our roles are crucial in healthcare. So accurate clinical documentation is essential for many reasons. And, I know you all probably know this, but take the time to recognize the powerful impact of the work we do. And here's why it matters. And just kind of a little bit about the advancement of is, lack of documentation can impact patient safety and care. It matters for accurate coding and reimbursement, quality reporting, clinical research and data utilization, coordination among providers, reputational data, and denial prevention. So each one of our queries matters and can affect all these things. So really, when you're looking at evaluating your CDI staff and looking at those query opportunities, it's really important to think of it as an educational standpoint. And when providing feedback on query opportunities that maybe got missed when you're auditing, is 2 quick tips is explain the why. Use the 3-legged stool, say this is a query that we see, what the clinical indicators are, the risk and related conditions, and the treatment and monitoring to support a why the query should have been sent. And then be supportive. Help your team understand why a query may have been missed. Instead of saying you should have, try phrases like consider or recommend doing this, just for it as a more collaborative approach. I thought it would be nice to share the top 5 query topics that we have in the last year reviewing thousands of records as we do audits. We group our topics by MDC, but we can also get more granular in the ICD-10 codes. But our top one is infectious disease. 15% gets that number 1 spot. Gotta love those sepsis queries. And then that's followed by circulatory, respiratory, kidney and urinary, and endocrine, nutrition, and metabolic. So before we get into the data section, I just wanted to pause and ask Allison Swinehart, our CDI director, and my partner in helping develop E4 Auditor, and Kathy Wagner, our e4health CDI supervisor of CDI audits, to share with them some of the insights. They are doing audits every day in that space. And Allison, we'll start with you. What are some most common issues you encounter related to query non-compliance?
Yeah. Thanks, Stacy. And I would first start off by sharing I've really never met a CDS who's malicious in their non-compliant practices. And instead, I've really seen where CDSs don't have really no idea that they're leaving a non-compliant query. Oftentimes, programs or leaderships will encourage or mandate their CDSs to review the practice brief, and then they work to have templates approved by various committees for compliance, and they think that they're following a compliant practice. But query writing is really an art, and a lot of the non-compliance findings that I see at the time occur when you're authoring the query. So for instance, the practice brief is very clear that we should only be providing answer options that are clinically relevant and supported. And so organizations may have templates that are compliant on their own, but if they're not altered to fit that patient's clinical scenario when they're delivered, they will be seen as non-compliant. An example of this is an anemia template. The template may include different types of anemia, such as acute blood loss anemia, hemolytic anemia, anemia due to chronic disease, anemia due to pancytopenia, etc. However, if the CDS does not remove all the non-relevant options prior to leaving the query and the patient does not have clinical indicators that support all those various types of anemia, that would be a non-compliant query. I've also seen an uptick recently in CDSs, including subjective interpretation into queries. So for example, the CDS may phrase a question something along the lines of, please indicate a diagnosis associated with the hypoxia. It becomes non-compliant with the query author interpreting the data, which in this case is a low SpO2 reading, and the treating provider has never documented the diagnosis of hypoxia. So by doing this, we're introducing now a new diagnosis, and it's not a choice and a multiple answer option, but instead it's subjective interpretation included in the question to the provider, which can really be seen as leading and non-compliant. So instead, as query authors, we really should be only including that objective data free of any interpretation by the query author. And in our example, that would simply be listing the SpO2 readings that correlate to the level of oxygen administered. So for example, listing 89% SpO2 on 4-liter nasal cannula as a clinical indicator, and then rephrase that question into something that's non-leading. From a validity standpoint, I think everyone on the call can agree leading queries is really hard work. It takes time to author the query, follow up on a response, escalate unanswered queries if needed, and then reconcile them at the end. So we also need to be mindful of provider query fatigue because we are codependent on providers. And when we leave queries, we want them to be meaningful and valuable, and we're expecting the physician to answer. So I commonly see opportunity here where the clinical indicators do not support asking the query to begin with. And so obviously here it's diagnostic criteria that's not being fulfilled. So it's a learning opportunity for the CDS with education and awareness that's provided in the audit findings. And so some of those common diagnoses I see with this are AKI, the various types of encephalopathy, and type 2 MIs.
Thank you, Allison. That was really insightful. Lots of stuff there to really unpack, but really that's helpful to see, as if you're a listener and you're an auditor, just things to consider when you're evaluating those query non-compliance. And then Allison, what specific recommendations would you offer to someone conducting a query compliant audit to ensure thoroughness and accuracy?
Sure. I would say start off by going back and rereading the practice brief. We joke that our audit team has the brief memorized, but you really almost have to because the brief does serve as our guide to measure compliance. And then I'd also suggest that you're really methodical and you standardize your audit process on all your staff, especially when you're performing follow-up audits. As I mentioned previously, we have like a 20-step process that our auditors follow, and we apply to every single query that we review. And you can start by creating a checklist of all those different aspects that you're going to review for that align with the practice brief. And then lastly, I find it difficult to only review the query and not the entire record. To determine validity, compliance, and enhancement suggestions, you really do need to know the specifics of the patient encounter and can't solely base your review on the query itself. Therefore, I would recommend that when you're auditing, make sure you review the entire record when you're providing compliant feedback.
Oh, thank you, Allison. That's great. And I always use that joke too. Like the query practice brief is pretty much memorized by our team. So they know that well. So Kathy, Kathy does a ton of QA for us. So we have our auditors do the audits, and then Kathy's in there doing quality assurance. And so, Kathy, what's the most frequent diagnosis you come across in your work, and where do you see the greatest opportunity for query improvement?
Well, going back to our data, I think sepsis is always one of the top diagnoses, but a lot of the opportunity isn't actually to query to add the diagnosis of sepsis. It's actually the clinically validity of the sepsis where we might see documentation where SIRS criteria is linked to another cause that's non-infectious, and we're still having that sepsis in there, so we need to be careful with that. I also think that we need to have more documentation with the organ failure related to the sepsis, and I think some query templates, there's opportunity in that way to adjust our query templates to have the organ failure to help support denial risk. And along with infection, linking conditions of the infection, whether it's to a device or a post-op infection, we see query opportunity with that. And another common opportunity in the infectious area is the resistance to multi-antibiotics with the different infections. We often find that as a CC opportunity for our patients. So that's for our infection. And then circulatory, we see a lot of opportunity with the acute myocardial injury. I think there's a lot of opportunity for education with the fourth universal definition of acute MI, where sometimes we're seeing queries ask that are including all the choices for type 1, type 2 MI, non-ischemic myocardial injury, and we have to understand what meets the criteria for these diagnoses so we're not giving options that aren't clinically supported, or even if the query needs to be asked, we need to look if we're really having a rise and fall in troponin. So I think there's a lot of opportunity there with education, with cardiology, and being with our staff with that diagnosis. Along the other lines with circulatory, we see atrial fibrillation, which is kind of common, but we often see the choices of all the different types of atrial fibrillation, paroxysmal, persistent, and chronic. And when you really review the definitions, there are certain timelines with that condition where all those options may not clinically be supported as an option, and that would make your query non-compliant. And finally, a common one is hypertension. Hypertension, urgency, crisis, and emergency. We often find that all those options may be left on a query, and you really need to make sure you're having some organ failure or something that would support that emergency category. So you would want to make sure that that's valid. So making sure those choices are valid. And finally, I'll end with the respiratory issues. Respiratory failure is a common query, making sure that you understand the criteria. And, I think it's helpful if your staff understands how to calculate a PF ratio to help support a diagnosis, and also making sure your choices are valid in a query. If you're leaving acute on chronic respiratory failure, the patient really has a chronic respiratory failure and is on oxygen full time. So making sure those choices are valid. And then pneumonia is another common one, making sure your choices are correct with your antibiotics that the patient's on, that they're have the risk factors for that type of pneumonia that you're suggesting. So those are some of the more common ones.
Okay.
I could go on and on, but yeah.
That's great, Kathy. Thank you. I think we could really actually, do another one just about different things that you're finding, because there's a lot of interesting ones there. And, thank you for sharing that. And I'm just going to kind of sum that up because I want to make sure we get to all of our content, and I got a little timeline, but I think if we could just say one tip about like what you're seeing is really tell me if you agree with this, is make sure you customize your audit or your query template. Would you sum it up or would you change that anyway?
Yeah, customize your template, make sure the criteria that you have matches your choices in your query. Yep.
Okay, great. Well, thank you, Kathy and Allison. I appreciate that. They are in thousands of records, so it's nice to have their insights. So thank you very much. So now let's talk about reporting. And I'll admit I get a little bit self-proclaimed CDI data geek. And as much as I hate to admit it, it's one of my favorite parts of my job is diving deep into the data and covering the story it's telling us. It's like piecing a puzzle together. And there's always something new to learn. And as we've been collaborating with our innovations team on E4Auditor for CDI audit tool, I frequently ask, and what I would recommend for you all to ask when you're doing your own audits is, what data do you want on the back end? Because as we all know, that data is opportunity, and it's not just about collecting numbers. The data that comes in, your data that comes in is what comes out. So you want to make sure that that's accurate. And so you want to make sure you're capturing the right insights on the front end so that you can have an accurate assessment. And the data helps auditors check if clinical documentation is complete and accurate, making it easier to spot areas for improvement. Having accurate data also ensures that appropriate reimbursement. And when you put dollars out, you really, you're probably usually saying that in front of the C-suite, and you just really want to make sure that you're got it down pat. You understand the multiplication, the relative weight, and really looking at that. Accurate data also really looks at identifying patterns or trends. Data helps find recurring issues in documentation, allowing you to address problems early. We really recommend biannual or triannual audits. So you kind of have a beginning one of the year, you see where that is, and then you compare year to year or audit to audit. You want to ensure compliance. Data tracks query compliance, preventing anything that could be problem with what we've talked about at Allison shared about query compliance. And data provides insights to guide decisions on process improvement, staff training, really shows where you need your education at. And then monitoring progress. It's really that objective data collection that tracks the effectiveness of your education. You have new staff and you're seeing them progress. Data just kind of makes things objective, and it's an efficient way to focus on driving your improvements. So just I always like benchmarks and data and stuff. And so when we're doing our audits, across all of our customers, we really find about 30% additional query opportunities, and we support those with the three-legged stool. We also have a rebuttal process, a query compliance rate of about 75%. Additional revenue is $400 per record review, and then that revenue at risk, we use that for those clinical validation queries that you're protecting from denial. Having that you'll find your own data when you do this, but like tracking and trending that and seeing improvements is always really nice. So one of the biggest challenges with CDI audits has been the lack of effective tools to track and trend data. And historically, we relied on spreadsheets or had to adapt the tools that the coding team uses. This can create some inefficiencies and make the process, of course, more cumbersome. And one of the things I truly appreciate about working at e4health is our access to a dedicated innovations team. These talented professionals work alongside us to develop custom solutions that drive efficiency and have been enhancing our audit process. I almost feel like there should be a drum roll or some fireworks as we introduce our CDI audit dashboard. It's a product from our passion for audits, and it reflects our commitment to creating a comprehensive 360-degree approach to auditing. Allison and I like to say this has been quite the journey, one that we're worked closely with our innovations team, and as two nurses trying to explain our ideas to incredibly talented computer engineers. Our languages aren't exactly the same, but it hasn't always been easy, but it's one we're really proud of. And so throughout this development process, we've also collaborated with other CDI leader colleagues at other organizations. And really thank you for those of you that have provided feedback. And what we're really doing is trying to create something that is very useful. So I'm going to try and switch here real quick and just give you a glimpse of our dashboard. Bear with me a second. Okay, So as you can see, hopefully you can see that, we have an overall general dashboard. And what we do is once we've been through QA, our auditors do the review, and then we do quality assurance on all of our findings. And then we give our customers access to this dashboard so they can see the records as they're being done. And you get the overall, that potential financial impact, the query opportunity, and the query compliance on that overview screen. This slices and dices it. So if you're a large organization that has multiple facilities, multiple regions, you can slice and dice it that way. You can also look at by CDS. You can select one CDS, see how many have been reviewed for that person, what their financial impact is, and look at that. And then we dive down deeper into each one of these. We got query compliance, just like what Allison said. What's that overall compliance rate? And then what did we find? Was it met, not met? And then if it wasn't met, what was the reason for it not being met? And so we divide that out. Or if there was an enhancement suggestion, they're compliant, but just really in that educational frame of mind is how can we make it better for next time? Query opportunities, this we break down by clinical validation queries and documentation clarity, just our normal run-of-the-mill. What were those topics? We use, like I said, the MDCs, but you can also do it into ICD-10 codes. And then what would that impact be? And we always assume that the query would be answered. And then what would that potential impact? We always use use the potential. And again, you can slice and dice this if you want to look at just one facility. You can narrow that down to, one facility. And then, of course, the names would all be provided in here. We've pulled out subsequent documentation. This is really important if you have a prioritization tool, because then sometimes those cases aren't prioritized. And so there's documentation after the prioritization. And so then we ask, give you some data there so that you can maybe go back to your vendor and say, hey, there's still some outliers here. Can we talk about the methodology to use to expand and what those topics are? Documentation capture, we're very clear with our customer. Our team is all clinical nurses that do that. We rely heavily on our coding professionals. But while we're in the record, if there was something that maybe wasn't in that top 25 diagnosis that really would have impacted the stay, we bring that to attention and let them know, hey, you might want to bring that to your coding colleagues to take a look at. Process review, that's just when we do our kickoff call for an audit, we spend, hour and a half with you thinking about your processes, what ones are value to you, like if you don't have a prioritization tool, sometimes initial reviews, subsequent reviews, you have timeline criteria for that. Retrospective queries, if they're done by coding or, they take up time, and the whole goal is to get them done concurrently. So could they have been done concurrently? We slice dice data that way. We can also do CDI coder mismatch, working DRG, those types of things. And then here's that thing I talked about, was that physician response, looking at that, the appropriateness. And then last but not least, we can do comparison. What was that query opportunity between your team and the query compliance? And then if you have another repeat, we can do that comparison. So if you'd like more on that, I would love to spend more time with you all on that at some point. You can put that in your feedback in the survey. So with that, let me do this, and excuse me for a second. Okay. And why did that go all the way there? Sorry, I am excited. So hopefully you enjoyed that and got to see a little bit of our E4 auditor for CDI. We're super excited about that, but not as excited as I am to continue our roundtable discussion with our panelists, Cheryl and Michelle. Thank you so much for joining us today. We appreciate you taking the time and sharing your expertise with our listeners. And so I will just ask, can each of you describe your current role and responsibilities within your organization?
Hi. Do you want me to go first? I'm sorry.
Yeah, sure. Yeah, that'd be great, Cheryl.
My name is Cheryl Barker. I am the CDI manager at e4health. Just a little bit about our facility. We're an independent nonprofit magnet facility up here in North Idaho. We have 397 beds. We also have 2 critical access facilities that are with us, and we cover 10 counties. Our department is umbrellaed with our transitional care services. So we work with case management, social work, palliative care, and physician advisors. I actually report direct to executive leadership, which is kind of nice. So I have that direct line of communication, which has been phenomenal. We get a lot of great support. As far as our CDI team, in addition to the concurrent review that we do, we also get involved in post-coding but pre-bill reviews. So we look at 100% of mortality cases, and we also look at a percentage of our hospice accounts. We also assist the quality department with PSI and HAC and infection prevention type reviews. We attend committees like sepsis committee. We work with case management on length of stay projects. We also have a really close relationship with the physician advisors on projects that they work on where the focus is really education. And so education primarily back to physicians and potentially other ancillary staff. And then last but not least, is we also get involved with DRG downgrades or denials, our favorite topic of the year.
Yeah. Well, thank you, Cheryl. Your team does a lot. That's awesome that you get involved in all those types of things. Michelle, are you still on? I'm not. Do you? I wonder if
I think she's having some issues muting. I'm going to try to help her out.
Okay. Well, we'll get back to Michelle, but Cheryl, we'll move on to the next question while we wait for Michelle. But oh, there she is.
Sorry,
Michelle?
technical
No worries.
difficulties.
No worries.
So hi, I'm Michelle. I work at LifeBridge Health. So shout out to my LifeBridge Health team that's on. Woo -woo. So my role here is AVP of Health Information Management. As most of you know, that's operations, ROI, coding, integrity, CDI. But I think what a lot of people would like to say, and I'm going to say it, is basically my role is the buffer and the defender and the translator between my team and the senior leadership team.
Very great. You got to be those buffers every once in a while, right?
Yes.
Cheryl, we'll start with you. So from your perspective, why do you believe an external CDI audit is valuable for your CDI team?
Well, what we found is that it's really the reviews and the audit is objective. And so that's a really something to highlight. Sometimes when we do an internal audit, sometimes, there could be feelings involved, or there might be some subjectivity that's not intentional, but it could come that way. Employees, when they get feedback from an outside source, they're more open to it. It also really, I think the biggest thing is it allows us to learn and grow, and the impact that it has on our daily practice has been phenomenal. And also what we found is that it actually fosters continued communication and conversations later, even after the audit, 3 months down the road, 4 months down the road, I can hear some of those conversations come back up. We work remotely. I see it come up in the chat, people saying, hey, don't forget about this. And so it kind of keeps everybody moving forward.
Thank you, Cheryl. That is several key things you hit on is like the objectiveness, right? Like you're not evaluating your colleague or somebody and I love hearing that it's more conversation, right? Like you have the audit and there's that investment up front, but then it is continually bringing that up. Hey, we had this done, and do you remember this? And I like that it's not just that one time, it continues. How about for you, Michelle? What's the value for your team for an audit?
I think you hit on most of them. I think the other ones that I had that I can think of is improve our compliance, making sure we're compliant, validating what we're doing. And the other big one I think is enhancing our credibility, having that third party, it helps us communicate better and give the senior leadership and others in the organization a better comfort that we're not just saying we're great. Here are my numbers, and we are great. And it kind of keeps us out of that tug of war between it's a coding CDI issue versus you have a physician documentation issue, or there's yearly changes in our weights. Well, guess what? You got to take that into consideration. So it kind of keeps us a little bit out of that spotlight. So I love the fact that it keeps my team whole and very positive, and we're just great.
that is, it really is bringing forth that to the senior leadership, right? Really showing that, like, hey, we're doing some great things, but there's always need for improvement. It helps say, like, hey, we need some education, but hey, we're doing a lot of things right, but hey, we could still use some support here. So what are some potential challenges you face with working with an external party for CDI audits?
So for some of the things that I found, I think the biggest one is getting the IT and technology access. I think that's probably was the most difficult, just getting access to the EMR and the CDI software tools, that type of thing, just because that involves different departments, right? Getting them involved in that. I think another big one is justifying the cost to complete an external audit. But I think you can justify the cost on that because, the impact that queries actually have on revenue, on compliance, reducing that risk of, post-payment denials, and if your queries are part of the legal record, that you're going to reduce that risk significantly. And I think probably the last thing was kind of like that staff disagreeing potentially some of the outcomes of the audit. So if you do have a company that offers a rebuttal process like E4 does, having that actually allows the team to be heard, and understand that it's a two-way conversation, and actually it's an opportunity for both parties to learn.
I love that. Thank you, Cheryl. I'll have to be honest. For years, I kind of was always like, oh, I'm not, and Allison and I were like, oh, the rebuttals, like, we're not really, not loving them. But now we're like 100% on board because exactly to your point is it creates a conversation, right? Like, our auditors are fully trained and I have 100% confident, but we're still all human, right? And so, if you see one CDI program, you've only seen one CDI program, right? Everyone has a little bit of different nuance. And so it's important for us to make sure that we're providing feedback that's valuable to your organization. And so we might not have, we try to cover every single policy and procedure, but we miss some, right? And so knowing that, thank you for supporting that rebuttal process because it is cumbersome and it's time consuming, but it really does bring value. How about you, Michelle? What are some challenges you faced?
So I think I have two big ones, I think. One is, I'm in a totally different state than everybody else. I'm in Maryland. And if anybody understands Maryland, we have a very unique financial environment and how we get reimbursed. We're not chasing CCs and MCCs. We're not even an MSDRG state. So for us, it's finding that that company that understands or wants to understand how we get reimbursed and how we could benefit from the audit that way, both ways, the vendor learning, but also us making sure that we're comfortable with the vendor that understands that. And the other big thing is just finding the right vendor. You definitely want to make sure that you have a partnership and it's not a dictatorship. You don't want the vendor coming after you saying, well, you did this and you need to improve on this. And we're here and we give you $10,000 more and we can get you this, this, and this. It's got to be a partnership. It's got to be a company that you are comfortable with, and it's got to be, someone that's going to meet your needs and, give you the right information that you want, that you need.
Thank you, Michelle. Those are really key. Really key. And you really, when you are evaluating, it really needs to be a collaboration, right, on both sides. And definitely know Maryland is very different. And I have to make sure that if you have something unique to your organization, that your vendor of choice will figure that out for you, and that's, their job. So thank you for sharing that. And then we kind of talked about this, but just think of anything else what are some key benefits or advantages? And I think we kind of talked about that a little bit before, but anything else to share about like CDI audits that bring to your organization, or anything else you'd like to share about your experiences from an external perspective?
Oh, go ahead.
Oh, sorry. I'm jumping, sorry. So I think to add to that, some of the benefits that we definitely get from external is the training and education opportunities, not only for the CDI team and the coding team, but also the vendor who brings back the information of, hey, here's your key service lines you want to focus on, and here are those diagnoses you want to focus on with those key service lines. That's helpful because it helps close our loop with the audit. Say, not only we got the audit results, there's educational opportunities, not just for us, but hey, I got some really great examples and really good feedback to give back to the providers for their documentation. The other thing too is, the one thing that I learned recently, not recently, but one of the things I like to do is we've had a vendor here at our facility for a very long time who would do these types of audits. And it was just a comfort level. It was one that the CFO brought in, and there was a comfort level with that vendor and thought they were giving really good feedback. I actually challenged that CFO to say, let's bring in another one. I think they're a little bit too comfortable. I think we're still missing some opportunity. I think there's other information that we should be getting. And he took me on for that challenge. And I'm excited that I'm actually having a little bit of I don't want to say competition, but I'm basically showing them that, there's other ways to look at the data and better ways. And I think because the vendor got so comfortable that we are missing some opportunities, and the other vendors not really giving us that feedback that we really need to close that loop. So it was an eye opener. And I think that having another vendor just validate, if you've had a vendor there for a long time doing it, just validating that they're doing the work that you need to have done. Things change. And you don't want someone that's just comfortable just checking your charts. You want to make sure you're getting everything you can get for the money that you're paying.
Those are great insights, Michelle. And, I probably didn't hone that in, but the education is so key, right? Like, you get so much data and information from an audit that you really want to be able to provide education to your team from that audit. And, that it should just go, like, in fact, I don't even like to do a proposal if they don't let me include the education, because you just don't want that data to die, like, because there is so much good information there. So thank you for sharing all of that, Michelle. Appreciate that. Cheryl.
Yeah, so I think I agree with everything that's been said, and it really, I think this was said earlier in the presentation, but that query compliance document, even though me as a manager, like, I have presented and educated on that particular document, and after having the external audit, there was some things that were, had kind of, we created our own opinion or created our own interpretation, I would say, of the compliance brief, and having someone externally kind of bring that back to you, that was valuable, just educating that out to everybody, and not only within the CDI and coding department, but other ancillary departments, getting back with our physician advisors. We found that to be extremely helpful.
That's great. It really is, that query writing is really an art and a science, right? Like, there is, and there are some still, even though they revise it, and maybe they'll be revising it again, we're hoping, like, because there are still, like Allison will say, there's a few still gray areas in there, right? Like, what this means to me might not exactly mean the same to you, kind of thing. As much as we'd like black and white check marks, we live in gray a lot, right? Well, thank you both so much for joining. Any other things that you'd like the audience to know, or any feedback or information nuggets that you could share with the audience?
Another thing that I was just thinking about is that we did not have an internal audit process. I mean, we had a few years back, but we kind of got away from that just because of all the demands and asks that's been on the CDI department. But we were in the process of re-implementing an internal audit process. And so we were able to pull some key things from our vendor to implement into what we're doing internally. So we found that that's helpful too.
Great. Thank you, Cheryl. And Michelle, yeah, you good there? And all right. So thank you. And so let's just got a few more things to wrap up before I show you how to get your active CEUs. So just thanks. I just love that dialogue and just hearing from other people instead of Allison and I talking. So thank you so much, Cheryl and Michelle, for your insights and willingness to share. So just really wanted to summarize in 10 key steps, tips for success. And that's with your audits. Start by clearly defining an objective to your audit, whether you're focusing on query compliance, query opportunities, identifying a process issue, that will guide your audit process. Before diving into your audit, understand your current performance metrics, review past audits and existing documentation practices to establish a baseline. Involve your CDI team early in the process, just like how I was a panic, let them know like, hey, this is a gift. We're investing in you. Our organization is paying for this and we want you to learn, right? We want you to grow in your profession. We want you to learn more. Focus on your audit on high impact areas where you pull and what you audit. Look at those problem areas. Look at AHD website for where you're maybe off on your MCC capture rate, which CCs. Leverage that data analytics. Look at your publicly reported data. Look at how you compare with your peers. Ensure thorough training of your CDI auditors because nothing will, if your auditors are auditing your team, you want to make sure that they're the best of the best. That's what we keep telling our auditors is like, you really got to stay up on a lot of things because you're providing feedback to others. And you want it to be consistent. You don't want one auditor to give this kind of feedback and another auditor to give another kind of feedback. So don't forget to QA your auditors, communicate findings effectively, just share with audit results and give them, how you can improve, tell them the why, provide education. Do not let all that information die from your audit, provide that education to the areas where there is opportunity for improvement. And it's always, we're never going to be perfect. It's always use that audit for that ongoing improvement plan. Focus on incremental improvements, not just, oh, it's audit time. We got to, make sure we do everything well. It's just like, do it across the board. And that will lead to some sustainable improvements for you and your CDI team. So I hope you found today's presentation of value to your practice. And if you'd like to collaborate more or learn more about how E4 can help you in your CDI program, please let us know in our post survey. Our CDI team loves helping our customers and we offer a bunch of different services. And if you are not an e4health customer, we don't want to take anybody from our customers, but if you're not a customer and you'd like to join our CDI team, we have an amazing team and we have open positions. So, reach out. There's a place you can check and we'll send that over to our TA team in the survey so that maybe you could be part of our team. And then, as you may have noticed, we are passionate about CDI here at e4health, and we have a vision of empowering better health. And as we strive to meet our vision and uphold our values in doing so, we want to make a commitment to helping our CDI community. And we do this by sharing complimentary monthly CDI tips, continuing our CDI roundtables. You can stay in the know with our customer newsletter, and you can follow us on LinkedIn where we post all those different types of things. So don't be sure not to miss them. And then if you've enjoyed today's presentation, we would like to invite you to register for our next CDI roundtable, which is going to be on April 23rd from 12 to 1 Eastern. And our topic will be embracing AI and CDI, what it is, what's next, and how to navigate it. Our SVP of Innovations will be joining us, as well as several panelists. I'm really excited about this. There's always areas to learn and not to be like, oh my goodness, is it going to take away my job? So a registration link will be emailed to you in our routine follow-up for you to join that presentation. And now what you've all been waiting for is you want to be sure to get your free Active CEU. To collect your CEU certificate, please be sure to take the evaluation using the link that is located in the Teams and the chat. And we will also include this link in a follow-up email with the webinar recording. Once you complete the survey, you will receive a link to obtain your Active CEU. And, we really enjoy reading that feedback, always looking at that on how we can improve and, what topics we can utilize going forward. So thank you all very much for your time today. We hope you found our presentation insightful, useful, maybe inspiring, and we hope you all enjoy, or hope you all join us in April. That concludes we'll leave this open for a little while just so that you can get that link. We'll leave that open for about 5 minutes and then we'll shut that down. As always, if you have any questions, we would love to have some conversations with you. I hope you all have a great February and hope to see you in April.